What is hypermobility? Hypermobility is a condition in which your joint can move beyond their normal ranges. It is due to the laxity, so the softness of the connective tissue, the ligaments and the tendons that surround the joint, making it more flexible than it should be. Common symptoms of this are the joints that easily move beyond range, so typically this is in at least 7 places to be diagnosed with hypermobility. Joint and pain discomfort, especially after exercise and activity. Increased risk of dislocations and sprains, so you may have noticed that you seem to have more dislocations and sprains than your common peers, and also an early development of arthritis. These are all very common signs and symptoms that you may be hypermobile. There are 3 different types of hypermobility. There's Marfan syndrome, there's Ehlers-Danlos syndrome, and then there's the benign hypermobility symptoms. So this is when you've not necessarily recognised any health implications yet, but you just notice that the joints are a lot more flexible. Ehlers-Danlos is a genetic disorder, and this affects the connective tissues and is extremely flexible, and also elastic skin as well. So if you notice that you have got either skin that if you pinch it doesn't seem to form back as usual as normal, or you have just noticed that there's a lot of excess skin around your joints, these can all be signs that you might suffer from Ehlers-Danlos syndrome as well. And Marfan syndrome leads to the features like long limbs being flexible but often having a stiff back. Hopefully this has made you a little bit more on what hypermobility is and what types of hypermobility are out there.